Hi and welcome back. This is section 3, so this is the last section I'll be talking to you about, and this is interpreting those slides that we have just gained via sellotape, impression smears and ear cytology. This is usually the part where everyone, oh my god, it's too hard. It's really not. It really isn't. You just need an understanding of what it is you're looking at, and then how much of it are we looking at. And then that will be able to help us categorise what kind of infection level we are looking at here. So to start, we're going to look at this slide. This is what we deem normal. We call this commensal cocci. So cocci is a bacteria that is present on all skin and within ears. We should find some cocci on every sample we do. It's when we start to see more that we need to think about, labelling that as, mild, moderate or severe. So this here is an ear. And I know that what you're looking at right now, you're thinking, oh, what's that big purpley blue blob in the middle? That's just earwax. You're not interested in that at all. At around about 3 o'clock, there is one very small blue purpley dot. That's a cocci. So that's a bacteria. And they do stain this way, a very small, dense dot, almost like a full stop on your slide. They're not very big at all. And as I say, we should see some of these on every cytology that we do. If you're not seeing any cocci on any cytology you do, I would strongly recommend that you go back and resample that animal, because I don't think you've maybe gained enough sample to be able to get a proper idea of what's on there. So if we compare the first slide to this slide, you can see the difference here. There is a severe amount of cocci here. There's also some diplococci. I'll go into it further along, but there are some white blood cells here and some nuclear streaming. This is quite an active infection. This is also an ear. And you can tell straight away that there is a very, very high presence here of cocci. So this would be deemed a severe amount. So if you compare this to the slide I showed previously, the difference is vast. I just wanted to be able to present for you the difference in what we're looking at here between normal and abnormal. So this is a slide with diplococci. This is another ear. Diplococci, this is where two bacteria are paired up together. They do look very similar to cocci. They're usually slightly bigger. They're very dense, compact, small dots, and they're paired up. So these do get confused for being rods. Rods are MRSP, are Pseudomonas. They're a much more, we need to be very careful with those cases, and we don't really want to get these two confused. So what I tend to do is, when I'm looking at them under the microscope, if there is anything that does appear rod-shaped as such, I'll use my fine focus to go in and out, and the diplococci, you will see a very small bud. I don't know if you can see my hands there. You'll see almost like a very small bud within the middle. Rods don't do that. They just stay that shape and then go in and out of focus. So just really utilise your fine focus there. So these are rods. These pesky little beings here are rods, and these are the bacteria we see with Pseudomonas and MRSP cases. And they do present as rod-shaped. You can see, you can also see why they're sometimes confused with diplococci. You really need to utilise your fine focus here. So these are presented as rod-shaped, very much like this. And sometimes they do present in strings. So they make these beautiful, beautiful waves. Look almost like strings of sausages from the butchers. These ears are usually very red, very sore, very swollen. It's not uncommon for us to see sort of very active infections here on ears or on skin when we have the presence of rods. So here at the hospital, if we do find Pseudomonas, if we do find rods on cytology, we will always then deep clean that room. That consult room will always then get a deep clean, and at the end of the shift, I will always set off a bomb. These are white blood cells. These are neutrophils, but you can get anything down there, really. So there's also some red blood cells here. I don't know if you can see them dotted around. They're the dark, almost shadows, just dotted around here. So this is the body's response to something's not right. Let's just spit something at it. And this is quite common to see in really active infections on the skin and within ears. It's not uncommon actually to see rods and white blood cells go hand in hand. You also might find that you get nuclear streaming, so that's those strips just going by. It's worth mentioning that to the vet if you do see them. In cats, it's quite common if we do skin cytology that we find eosinophils, but then that's their body's defense to these things. So don't be too alarmed if you're seeing, particularly on cats. I know I've talked a lot about dogs, but the same information does apply to our feline friends, that you will find more of those pinky granulated white blood cells than you maybe would on a dog. There's also some cocci and things down on this slide. You can see a fairly big bunch down at the bottom there. The last slide I wanted to show you, so this is something called malassezia. These aren't bacteria or a blood cell. These are actually yeasts. They have a very distinctive smell. They smell like ears, if that makes any sense. Just that wet dog smell. And I've always been informed that there should be some within the ear. They should live upon us. Whereas recent information coming out, new papers and things like that, suggests that we should find none. So that's definitely something, if you do wish to pursue this, definitely keep an eye out for. Great thing about this profession is things are always changing, and there's always a new way to learn. Hence these CPD things, it's absolutely wonderful. So these guys, I've got a really good section here up around about the 2-3 o'clock mark. They are really, really beautiful. Spoken like a true microbiologist, I know. So these are described, it's got lots of different names, snowmen, peanuts, Russian dolls. My absolute favourite is footprints. I get a lot of enjoyment from thinking somebody's just do all over the slide. Again, typical microbiologist, look at my smile. And you can actually see here, there's some that have taken up a ginormous amount of the stain, but if we look over to sort of in the middle, around about the 9 o'clock mark, there's a fairly see-through one. So this really highlights, as I was saying to you earlier, really extend the amount of time that your sample has with these stains. Otherwise, this is what you're going to see. You're going to see always these outlines, these ghost cells. And you need to, particularly with like really gross ears, you're going to need to get through a lot of layers of crud. So really think about how much time your stain has in contact with your sample. These guys are actually quite large as well. So to put it into perspective, there are some cocci down here. So if you just look at that cluster that I was talking about at 3 o'clock, directly under at 6 o'clock, there is a cocci. So you can see the difference in size here. The malassezia are actually very, very large in comparison to size-wise to the cocci. All the other slides that we've looked at, I would put as a moderate. A severe, sorry. This one I would put at as more of a moderate. So anything, when you're looking at a slide, if you've got stuff, anything sort of, if there's 5 per high power fill, mild, 5 to maybe 15, 20, moderate, anything over that. So if your slide is a wash, a bit like when it on the cockeye and the rods that I showed you, that's quite a severe amount that we're seeing. So the only other thing worth noting with malassezia is it's quite common for them to infect their nail beds. You can differentiate this by there being like a brown discharge at the top of the nail beds. So if they do have malassezia present in their feet, which it would be worth, you know, just having a look at those toes, because if we don't look at providing some sort of plan for those, when they scratch, they're just going to reinfect those ears. So we need to, malassezia, we really do need to look at the whole dog as well, really. So that's it from me. Thank you very, very much for your time today. I really hope that you have enjoyed my talk. I just very quickly before I finish, I do just want to reiterate that as a nurse, you can do this. It's something that you absolutely can do. I have found an entire career based off of the fact that I can provide a simple skin cytology, and I have a wonderful job here at Langford, which I very much enjoy. It's something that I really do feel that all nurses would benefit from knowing, all patients would benefit from nurses knowing. So yeah, thank you very, very much for your time today.